Alrighty. You guys ready?
Ready.
We're gonna talk about Alzheimer's, and we're gonna talk about schizophrenia, we get that far today. So, let's do a little recap of cognition. So how do you know if somebody's in delirium versus dementia? One is acute, which one is acute? Delirium, right? If somebody's delirious, that's an acute problem that they're having, right? What's gonna be more affected, long-term or short-term memory? Somebody who's delirious. They're short-term, right? What about somebody who's demented, has true dementia? Also their short-term memory, right? So we can't always gauge that memory, okay? What are we gonna do for people who are confused? What are gonna be our nursing priorities? Reorient them, find out how long it's been going on for, right? Is this an acute problem or is it a long-term thing? Is it something physiologically going on? So they have another problem. They have an infection, or they hypoxic? Did they take something that's making them act this way? Substance abuse, drugs, alcohol, something like that, right? Okay. What else did we talk about? ADHD. How do we know if a kid has true ADHD? What are some signs and symptoms they're gonna present with or have difficulty with? Focusing, learning, hyperactivity, fidgety, acting out, right? How are we gonna treat them? What do we do with those kids? What? Stimulants, methylphenidate, also known as what? Ritalin. What's the other drug we give them, Tracy?
Adderall.
Tell us about why you didn't get sleep last night.
Because a 14-year-old took a bottle of Tylenol and a bottle of Adderall.
So where I said they are very highly suicidal, these kids. There you go. Ooh, 14 years old, tried to OD on a bottle of Adderall and a bottle of Tylenol. Eat, right? Okay. What? Drug of choice. There's stimulants, so sometimes to the addictive population, they might try to steal those meds, right? You come from a family that has troubles with addiction, which might be kids who have ADHD, right? Because if your parent did drugs, did meth, well, if they were pregnant with you, good chance you're gonna have a learning disability, ADHD, might be on those drugs, so education. Sometimes you have to educate the kid in a situation that people might try to steal their meds. What are some considerations with those drugs? Like methylphenidate, it's a stimulant, so when do we want to give it? In the morning. It has to reach a therapeutic dose, right? So we taper it slowly. Give in the morning. Monitor for signs and symptoms. What else do we want to monitor for? Suicide ideation, right? Okay. What if they're autistic? What do we do for those kids? How are they gonna act? Maybe won't communicate, won't make any eye contact, no social interaction, or be very difficult for social interaction. What's the other drug we give to kids? You don't remember? It was on your HCI as well? Or it's on the HCI as well? Strattera. What are considerations of that drug that we need to know? Liver function, it can affect their liver. So what signs and symptoms do they present with if their liver is being affected? Jaundice, weakness, fatigue, bloating, right? Okay, so let's talk about Alzheimer's disease. I'm sure this is something you guys all know what it is, right? Anyone know somebody with it or have family members affected by it? Nobody. Oh, I see. Yeah, we all, man. Heard a novel. Your life. Okay, so we know it's the most common degenerative neurological disorder. It usually affects people at age 65 and older, so usually an older age disease has a later onset in life. Although there has been a few cases of people diagnosed in their 40s with a very early onset. That's more rare, but it can happen. They present with the same signs and symptoms, so start to have some neurological or cognitive changes. It can have fatal complications, so people don't always die, particularly from Alzheimer's itself, but they die from the lack of their brain being able to function like it should, and then they usually die from something else. A lot of times they'll just stop eating or stop taking care of themselves, and that's what will actually become fatal for them. So, progressive degenerative changes. So there's a lot of different theories out there of what happens within the brain or what the true pathophys is. We know that there's some atrophy of the cerebral cortex. So their ventricles in their brain actually start to kind of get smaller or change their shape or tend to die off. Their neurons tend to die, so they don't have those good synapses anymore, which is why they can't remember anything. They start to lose their cognition, they start to lose function, they start to lose kind of their muscle ability, their balance, all those things, right? They can also get plaque in the spaces between the neurons. So just like you can get plaque in your heart, that can give you heart disease, they can get plaque in their brain, cause brain disease, or Alzheimer's. So they have a steady decline in physical and mental functioning. Obviously can cause severe mood changes, anxiety, depression. It's a stress response when they realize that they're starting to lose their memory, or they're starting to not have the cognition, or not be able to do the things that they once were able to do because their brain is changing. It can be very affect their mood quite a bit, right? They can become depressed, they can act out, they can try to cover it up or pretend this isn't happening. It can cause a lot of stress on them, right? So there's a cholinergic hypothesis that they have lower acetylcholine production within the brain. What is acetylcholine responsible for? What? You're probably right. I just didn't hear what you said. Saliva, somewhat. A lot of your like motor functions, right? So movement, walking, balance, acetylcholine will do a lot of those things. So if you think about people with Parkinson's, they lack acetylcholine. So what do they look like? They kind of have this Parkinsonism syndrome. So like mask-like face, they lose expression. Their gait may become really slow or uneven gait, unsteady gait. They can also, there's the amyloid hypothesis where they get these plaques that build up in their brain and then it affects the blood flow. So they're not getting good circulation to the brain. Tau hypothesis is where their neurofibers become tangled and intertwined. So there's not good neuron transmission in the brain happening. Or there's myelin breakdown, so around the nerves there's breakdown or oxidative crisis. So what does oxidative stress or oxidative crisis mean? Like environmental factors that cause the brain to not work. So what would those things be? Pollution, smoking, if they drink alcohol, poor eating habits even, right? So just general health things in general that make you have comorbidities in any other part of your body can be the same thing that happens in your brain, right? So environmental things that aren't good for you in general. So some risk factors, obviously age. So again, onset's usually over age 65. There are some rare cases when it's in younger people. Family history, there is a little bit of genetic correlation. Gender, do you think it affects more women or men? More women typically, but women tend to live longer. So sometimes it's, maybe that's why they have more incidence of it. But typically it affects more women than men for whatever reason. Or if they've had any sort of head injury, trauma in their life to the brain. So if they had a stroke, if they at some point had a bleed in their brain, or some sort of head trauma, concussions, anything like that, potentially could put them at risk to developing this later on. So how are we going to prevent it? Can we truly prevent Alzheimer's? What do you guys think? Can you prevent it? If they have those risk factors, they don't really know, right? There's a lot of research out there that if you eat a good diet, be physical active, challenge your brain, do Sudoku, do crosswords, right? You guys probably heard these things that if you keep your brain active and keep it young, that you'll prevent getting cognition problems, but there's some people that still get it. So I don't think there really is like any magic crystal ball that says if you do all these things, for sure you're not gonna get it, right? They don't really know. But we know it's always good to do preventative things anyway, just for overall health. So keep their brain healthy, good diet, good exercise, consume protective foods, so not a lot of processed foods, just like with everything else, right? Mentally, socially active, avoid use of drugs, alcohol, any sort of substance that potentially could alter cognition. So some warning signs that they might have an onset or that they might be experiencing some cognitive problems usually starts with some sort of memory loss that can affect maybe their job skills. So remember, onset's about age 65, that's usually when people start retiring from their jobs. So there's a lot of theory or there's some myths out there that people stop working and then they stop using their brain, and so that's when it hits them. That is purely a myth. But sometimes they'll start to have memory loss or slow, maybe very little subtle cognitive changes that maybe they realize but are able to cover it up and no one else really sees. Or they just relate to, oh, I'm just getting older. Now remember I said on Wednesday that really cognitive changes is not a sign of old age. Like you shouldn't have cognitive changes just because you're aging. It's not part of the normal aging process. But a lot of older people think, well, I'm losing my mind, I'm just getting older, right? It's a myth, it's a protective mechanism, they say, to maybe cover up that they're starting to have some of these changes. So if they notice problems with language, maybe they can't, the words don't come from the brain to the mouth, right? Not that they're truly aphasic, but they have problems finding words or seeing what they want to say, right? Poor decreased judgment, maybe unable to abstract think or problem solve anymore. They start to misplace things, so they can't find the keys, they can't find a remote. They went and got groceries and they left their groceries in their car. Just kind of simple things that maybe are so subtle signs that, hey, maybe there's something going on in the brain. Changes in their behavior or mood or personality. So people with true cognitive changes, it will change their mood or their personality. So they might have depression, they might have anxiety, they might have different personality traits that they didn't have before. It might be a red flag that, hey, something's going on. Okay, so there's the stages. So stage 1 is pretty normal. So again, they might start having a little bit of cognitive impairment, not until stage 3. So stage 2, they start to have a little bit of forgetfulness. Maybe they can't find their keys. They forgot to take their pills this morning, something like that. And then it slowly progresses into stage 7 or 8 where they have severe Alzheimer's disease where they truly can't even take care of themselves, right? They might need to be in a memory care unit or like a day program or something because they just can't take care of themselves. They're not safe anymore. This slide is a lot better, I think, in staging it as early, middle, or late stages. So obviously early signs, they forget maybe very subtle things again. They have trouble organizing or planning, so their problem solving is not there. They're just, ability to make decisions doesn't seem like it's there anymore. They forget where things are. They maybe have trouble starting to manage their finances, or subtle things is they don't pay their bills, and they normally were very cognizant of making sure their finances were always paid on time, and now maybe their water bill wasn't paid or something. Could be a sign that they're having some early cognition changes. Maybe they forget recent events or current events or things that are happening on a day-to-day that normally were important to them. Trouble with challenging tasks at work if they're still working. They start to maybe not be able to find their car when they walk out of Walmart, right? Maybe some of you guys have that problem. You don't have Alzheimer's. Okay, and then the middle stages, you can see it starts to get a little bit worse. They might have delusions, so their reality is not the reality that they're truly living anymore. Compulsions, repetitive behavior. They become more agitated again. You might see personality changes or cognition changes. They might need assistance with their ADLs. They might might start to become incontinent, or you might start to see them in middle stages that they start to have more health problems, right? Because they're not taking care of themselves like they were. Or maybe they're not taking their medications anymore, or they're not as compliant with their meds because they're not remembering if they took their meds, did they take them, when did I take them last, those kind of things, okay? And then if it is the late stages, this is significant behavioral and personality changes. They're unable to hold a conversation. They might have trouble eating, moving, swallowing. They might be completely incontinent or have no control of their bowels or bladder. A lot of times they stop eating, they stop taking care of themselves at this stage. They can be very susceptible to developing other diseases at this point. So what are some things we would do for people in these different stages? What are simple nursing interventions that we could do? What do you guys think? In the early stages, what are things you could do? Somebody who's
Reminders.
starting to lose their mind a little bit, or starting to lose their memory.
Reminders.
Reminders, so simple calendar reminders, right? We live in a world of technology, smartwatches, they can have like, set an alarm for these people, ding, time to take your 9 a.m. meds, check it on your calendar that you took off, checklist, right? Anything that will kind of help them remember. Notes around wherever they live, like remember to do this, did you take your meds? Calendars, doctor's appointments, right? What about when they get more in the middle stages, they're having more complications? What are things that you might have to do, or interventions? We have to consider, are they safe, right? Are they safe to still continue to live alone? Or do they live with somebody who is able to take care of them and really understands their disease, right? Understand this is gonna get worse. Some people with this disease, they'll get up in the middle of the night and they think that it's 6 a.m. in the morning, it's 3 o'clock in the morning. And they're trying to cook breakfast at 3 in the morning. Or they'll turn the stove on and make something and then they forget that they turned it on, and so there's a risk that they could burn their house down, right? Or if they have like a gas oven, they could fill their house with propane. Could be a major risk, right? So we have to consider safety and a lot of education to their families of what are all of the safety considerations that you have in your home. Are they still cooking? My husband's grandma had Alzheimer's, and so his grandpa would have to unplug their oven so this grandma wouldn't go and try to cook, because she literally would get up at 3 in the morning and try to cook breakfast. Or turn the stove on and then go out for a walk and it'd be on for 2 hours. So what are simple things you can do that, so reminders, safety things, a lot of education to their family members, right? Sometimes you have to put curtains over their exits because they're constantly kind of wanting to escape. They feel like they're trapped in kind of, because they're trapped in this brain that isn't working like it used to work. So sometimes they'll put like a curtain over exits, or locks, multiple locks on the doors, or locks up high so that they can't get out that exit and go out into the street in the middle of the night. There's been cases where elderly people have been out walking in the middle of the night, got hit over, ran over, killed, dead, and come to find out they had some cognitive changes and their family thought they were sleeping. So this stuff happens, right? So little things we can do. There's no really diagnostic test to diagnose. These are brains that they've looked at after people have died. So your normal, healthy brain, mild cognitive impairment, and then what somebody's brain with Alzheimer's look like. So you can see there's some major changes of the cerebral cortex that happens, which is why they can't function, they can't remember, they can't do all those things when it gets severe, right? Because they have these major changes within their brain. So what kind of drugs can we give them? So sometimes we can give them things to help their memory. So that's what an NMDA receptor is. It's the memantine, the Namenda, those are 2 drugs that we can give to help people's memory. There's another one called Abilify, which is like an atypical mental health drug that sometimes we give them that helps their memory. Acetylcholinase inhibitors. So remember, they have a decreased acetylcholine in their brain, which makes them kind of their function slow down. So if we can try to inhibit kind of the production of that in their brain, we can slow the process down. So there's really no medication that can cure this or can stop the progression, but they're looking at meds of how can we slow the progression down, or give them the most time that we can before it turns into major memory problems, major cognition loss. So these are drugs they can give them that will slow the process down. They come with a plethora of side effects, so decreased appetite, nausea, vomiting, dizziness. So you have to kind of educate their family on those precautions. They usually don't give these memory drugs until later stages because of the side effects that they can have. And then if they have major mood changes, they'll put them on like antidepressants or antipsychotics, depending on what their mood is or their personality traits. Some people with Alzheimer's, they'll become very, very impulsive, and sometimes they're more apt to act out in anger to the people that are closest to them. Because it's kind of like a child, like they're naughty, they're usually the worst around their parents because that's who they feel the safest with. Same with people as they start to age and start to have mental decline, they might act out to the people they're closest to because that's who they feel safe around. And they're really struggling because they have these changes going on in their brain and they don't really realize why or what's happening. So some non-pharmacologic therapy we can do is like speech therapy, physical therapy, occupational therapy. Do they know about disability benefits that are out there? What resources are available to them? So they might have to be in like a day program. Maybe their spouse is still working and they're not safe to leave at home. So then what are we gonna do? Maybe they don't necessarily need to be in like a nursing home or assisted living, but maybe they need to be in like an adult daycare program where somebody can kind of watch them while their spouse is working during the day. Or if they're up all night long and their spouse stays with them all night, maybe they need to go to like an adult day program so their spouse can get some rest during the day. Or maybe they need a caregiver who can help give their family a break, right? If they refuse to put them in any sort of home. There's a lot of new research on the keto diet. Has been very successful in reducing the risk and actually slowing the progression down of people with early Alzheimer's. A lot of research in that area. Somebody could have done their research on that. Should have brought that up sooner. Now you guys have your topics, but a lot of research done on that. There's been brain scans done on people who they were starting to deteriorate and they went on a full keto diet and it kind of reversed that damage. So a lot of new research in that area. So again, provide a very safe environment, support the family members, as it's very hard for them to deal with these people's cognitive changes and the emotional demands. Monitor their ADLs. So are they able to dress themselves? Are they able to feed themselves? Are they getting enough nutrition? Look for trends. Is it getting worse? Is their memory tending to get worse? Is their cognition getting worse? Help them maintain independence. Consistent routines. So if they know that, okay, I get up, I take my meds, I eat breakfast, and then I'm going to take a little nap, and then I'm going to watch a show for 30 minutes. If they have a very structured routine, it's a way they can kind of watch their trends, right? And it gives them something to know kind of when is this getting worse, and then are they able to stick to that routine? Also, exercise is important. It helps their brain function a little better. So we want to assess, do they have any family history of Alzheimer's, any other dementia? Have they ever had any sort of trauma to their brain, any head injury, any stroke? Is there any other physiological problems going on that could be affecting their cognition? What meds are they taking? Polypharmacy, right? Is there any meds they're taking that potentially could be affecting their cognition, or have they recently been started on any new medications that potentially could be altering their cognition, right? Do they have any underlying depression, anxiety, mood problems that we should be aware of? Because those might escalate as they start to lose their cognition. We might see those come for a little bit. Stronger? Are they able to sleep? Are they able to eat? Are they able to do their normal activity? I already said this. Do they have any sort of alcohol abuse, substance abuse, anything else that they're taking or abusing? Because if somebody is starting to lose cognition, we we probably don't want them to be putting like a sedative or alcohol or some sort of substance in their body that could affect their cognition even more, right? They can do a mini mental status exam, so I think you guys have a slide on yours that shows a mini mental status exam, so they might ask them like, okay, I'm gonna tell you 4 numbers, and then they go on and ask them a couple more questions. 10 minutes later, you say, what were those 4 numbers I told you to say? Or have them state a couple words, and then they come back and state those words again. Sometimes I'll have them draw a clock, so they'll do this for people 65 and older, their primary care, they'll have them draw a clock, and if they start to have cognition changes, they'll actually turn the numbers around. So like the 6, they might put where the 9 is, or their clock won't look like a normal clock. It's because they're starting to lose that part of their brain to be able to do that. So those are things that they can do, small assessments to see, okay, are you truly starting to have some cognitive decline, some memory decline? So some things that we can implement, cueing devices, so setting alarms, calendars, setting things on their phones. There's apps out there that they can use for people with early memory loss, like reminder apps that their families can program for them. Like, remember, you need to eat your snack now, you need to take your 9 o'clock meds. Pill boxes, so maybe somebody comes and sets up their pill box for them, or color coordinates things for them, so they can say like, okay, I know that I have to take the pink pills at noon, and I take the pills in the green box at 9 a.m., right? So just simple things we can do, lists, reminders, alarms, list of loved ones' contact information. They'll sometimes have them wear like armbands with their loved one's phone number, so if they do get lost or if they go wandering, they know who to call. Sometimes they'll put like a sticky note inside their clothes, or like put tape on their clothes with their loved one's phone number if they're truly wanderers and they're worried they're gonna get lost somewhere. Because how scary would that be if they get lost and they have no clue where they're at? They might have to take their keys away if they're driving for the safety of other people, so they don't go driving in the daylight and run into somebody or get in a wreck or harm someone else. Locks, double locks, well-lit rooms, safety controls in the oven. Sometimes I'll tell them to turn down their water heater in their house so that they don't burn themselves, because they might just crank the water on and not really think of like, hey, I have to check the temperature when I get in the shower, and so they could burn themselves. Things like assistive devices for like showering, just your normal ADL stuff. Have an emergency plan. Remove like sharp objects, or if there's any guns in the house, you obviously wouldn't want those with somebody with a cognitive decline. Monitor for fatigue, agitation, remove any situations that potentially could cause anxiety, maybe a lot of reorientation. In the earlier stages, they're going to try to cover up their memory loss or that they're having cognitive problems. So you might have to plan to that a little bit. Keep their routine very consistent. Give them rest periods. Encourage naps because they might not be sleeping well. Quiet activities are better. Assess again, is there any sort of physical thing that's causing this problem, or is it truly all like psychological, right? And then what are some community resources we can use? So some in-home care services, so maybe they need like a home health nurse or a home health aide. This is really hard for people. When my husband's grandma was kind of at the later stages of dementia, and she was getting up in the middle of the night, wandering out in the street, and her poor 90-year-old husband was trying to take care of her. He was very spry 90-year-old, but still very wearing on him. And the problem is, she didn't really qualify for home health because she was pretty much able to take care of herself. She didn't have a lot of physical needs, so they couldn't really get anyone to come in the home and take care of her. And then when they tried to hire a personal caregiver, and she refused to let anyone else in her home. Like, she was a very feisty lady, so she refused to let anyone in her home, and she would be cussing at them and screaming at them when they showed up at her door. Like, get the hell out of my house. So these people are very hard to deal with sometimes. It's very stressful on the caregiver and the family. So as nurses, we sometimes have to talk to the family alone without the patient and say, do you have the resources you need? Are you truly able to take care of this person, right? Because they might be 70, 80-year-old, 90-year-olds trying to take care of each other. And that's very hard and really not safe, right? So is there other respite care? Is there other people out there that can help them? Do they have family members that can help? Maybe they need, like I said, like adult daycare. There's respite programs where they can be in the hospital and respite. So you're probably taking care of people in the hospital who are there for just respite. It's basically there to give their family a break, so they can take a rest while they know their loved ones being cared for. So a constant assessment, is it getting worse? Are we seeing more of a decline in their cognition? Do they need to go into more of a like assisted living or a memory care unit where they're safe? Keep them free from injury. Are they getting enough nutrition? So monitoring their weight over time. Are they having significant decrease in their weight? My husband's grandma died because she simply stopped eating and refused to eat, and that's what killed her. She just didn't get nutrition. Basically failure to thrive, which is pretty common because their brain just shuts down and they don't think they ever need to eat. So do they take their meds? They might not become compliant. So if they have other issues, like if they have extremely high blood pressure and they don't take their meds, maybe they'll stroke, right? So are they taking their meds? Are they taking care of themselves? Use memory aids? And then do they have any community resources? In rural areas, it's really hard to find community resources with people with memory problems or somebody to help come and take care of them. Okay. We'll see if this video will today.
They have a movie out, which is called The Notebook. And that's of this guy that's reading this notebook to this woman in the hospital. And at the end of the story, come find out that it was him and her. It was in Argentia, Newfoundland, and I met her in July 1961. First, actually I knew her before that, but I formally met her in 61. And we both worked at the AC-Doozy Club in Newfoundland, in Argentia, Newfoundland. She was a waitress and I was a bartender or duty manager. We dated a couple times, and then we went to, I guess I asked her to marry me because we got married in September 61. Everybody says, how did you do that? I don't know. It just, you know. It was, no, I don't know if anybody's ever been short of a courtship and still married after 54 years. Well, really nothing, honey. I know, Franny. I know when you work, maybe get a half hour a week in here. That's not too bad.
What are you doing up here?
Working on a dollhouse drawing. She's not remembering things, you know, just not remembering how to do things. Like she used to do all the checkbook and everything all the time. She couldn't do that anymore. She couldn't cook anymore. She couldn't do the checkbook anymore. That's in about 2012. Yeah, and then she was diagnosed in 2013 of having Alzheimer's.
Come here.
What do you want? Get up and come in here. You just stand up and walk in here. Pretty far along. She's in stage 6, upper stage 6, probably possible 7. She was always friendly. She was talkative. She knew what was going on all around her and everything. I think every once in a while, I want my old friend back.
Oh, Mary, you're my best man. I told you that before. I told you how many years.
I always think about I want my friend back, but I know it's not going to happen. It's gone. it's a nasty disease. It really is. It just eats away at a person. She doesn't know who she is. She don't know me. You're talking to her and it's like you're talking to the wall because she's not there.
I go in until the doctor does. I pick it up, person comes up and they fix it, and that's it. Nobody else gets anything.
They give you medication to slow it down. That's all they do. Just a disease that eats away at your mind. The nurses asked me when they brought her into hospice, they says, do you think you'll put her in a home? I says, never. The only way she's going home is over my dead body. And there's no way. Because she doesn't belong. She wouldn't fit in there. There's just too much going on in her mind that she just wouldn't fit. Somebody asked me the other day, says, what's it like? I said, well, I was married 54 years ago, and I said, till death do us part. And that's exactly what it is. I have to take care of her. That's my job.
So what are some like key points that stick out to you guys? Okay, so there's some subtle signs right away, right? In the earlier stages, what do you think? Early symptoms. And then it progresses to where they truly can't take care of themselves, they don't know who they are, they don't know who their loved ones are. So that's very, very challenging for their family members, right? Or like, it didn't say if they had children, but somebody who has kids, it can be very, very hard when you're a parent, no one recognizes who you are, right? That's kind of been your person, your go-to for your life, and now they don't even know your name. So it can be very, very challenging, complex disease, and it's a slow decline, right? So it's something that they might be stuck in kind of the late stages for a long time, or the middle stages for a very long time, and then who's gonna take care of these people? Right? They can't take care of themselves, right? But a lot of times their family members don't want to put them in a facility. And if you've worked in a memory care unit, very discouraging, it's very hard, right? They're in this locked in unit with people they don't know, they don't even know themselves, now they're with strangers they don't know. So it'd be very, very hard on the caregiver, right? Alright, so we're gonna do about pretty good grades. How much class you want? Right. Mary. Ryan, did you do it already? And Ryan. So one of you is gonna be the family member and one of you is gonna be the nurse.
Family member.
Okay, Mary, you can be the family member. So you have to look through this script, and Ryan, you're gonna be the nurse. Remember, focus on communication. Because this is something you guys will probably deal with, because when they start to lose their memory and cognition, they usually start to have some physical impairments as well, right? So you might see them in the hospital setting with some physical impairments. So you kind of look through that. So we're gonna use this scenario. So you're the nurse taking care of Miss C. She's had Alzheimer's for 3 years and is end stage. Her husband's in the room with her, is tearful, and wants to take her home, but you're concerned about the safety of him taking her home. So Mary's the wife and is gonna take her husband home, who has Alzheimer's for 3 years, so she's much older. And you're the nurse who's gonna try to convince them that maybe that's not the safest route. Or do they have the resources available to them? What do you have to worry about, right? Because as nurses in the hospital, we have to worry about what we're doing for the patient in the hospital, but we should also be thinking about what happens when they go home. What resources do they have? Are they safe, right? And it does fall on your guys' shoulders as nurses, because if they go home and they walk out in the street at night and they get ran over and killed, well, should we let them go home safely? Right? right? Okay.
I promised I would never put him in a nursing home.
Well, sometimes that's just the best thing you can do is, it's a lot of responsibility to take care of, a family member with this kind of diagnosis in your home.
What is he gonna do there?
Mostly, so we'll just keep him around, make sure he doesn't wander off too far or get hurt in any kind of way. We'll make sure he takes his meds, he gets fed, he has daily activities that he can do, and he can interact with other people that way.
What am I going to do?
I would say just try your best to stay strong. There are visiting hours that you can come visit at any moment in time, basically all during the day. You can visit him as much as you want, but I think this is the best way for him to keep on living with the diagnosis he has.
I suppose that'd be better, but it's so hard.
I know it's hard. It's a hard disease. It's hard on him. It's hard on family members, but it's just something we have to deal with.
Will you guys say any different? That was my shoe, by the way. So you're all wondering. It's where that was my shoe. Anything else you guys would say differently?
I emphasize safety.
Okay, emphasize safety. What were you gonna say? It'll progress and only gets worse. So really does a family have a true understanding of this is not like something we can quick fix, right? We're in a society of quick fix and we think like meds will fix it. There's gotta be something we can do to help them, but no, this is going to progressively get worse. It's also going to be very wearing on the caregiver. So maybe, who else do you have for support? Do you have children? Is there other people that can come in and give you a break? Because there's going to be times when you need some help. What else could we say? We really gotta help them understand this disease, right? But what else can we say or do in this situation? Communication wise. Okay. What is your plan? How do you plan on taking care of them? Do you have these safety things in your home? Some of those things we talked about. Do you have locks high above your door that they can't reach or that they don't see? Do you have, is there anything they're gonna trip on, or have you removed things that potentially could be harmful to them, right? Anything else you guys would say or do in that situation? Or dealing with anyone with severe cognitive decline? What do you guys think? Anything else, communication wise? How are you coping with their diagnosis? And if they start bawling, the family member, then you know they're probably not coping very well with this, right? Maybe they need some resource or somebody to talk to. Because again, it's very, very hard on the caregiver. The patient doesn't know what's going on, right? That's very, very hard on the person trying to take care of. Okay? Why don't you take a break, and then we'll switch our minds to schizophrenia.